Patients with poor ovarian reserve are difficult patients to treat for IVF specialists, and the success rate is usually poor. This is because IVF pregnancy rates depend on the quality of the embryos we transfer, which in turn depends on egg quality. Because they are poor ovarian responders, the quality and quantity of embryos we are able to generate for these patients is usually poor. This is why it's quite challenging to help these women have a baby. You need to understand what your treatment options are, so you can follow this in an organized, systematic fashion. If a patient's ovaries didn't respond well to an earlier IVF cycle, the first thing that can be done is to increase the amount of the injections that are used for superovulation. Although you can't be sure if this will improve ovarian response, it's good to know that you have tried everything that might work. Vitamin D and DHEA are often given to these patients before they start an IVF treatment because they can help improve their ovarian reserve. If the extra dose of superovulation hormones doesn't work, we'll move on to a mini stimulation procedure. This may seem like a contradiction. If a big dose of hormones didn't work, how could a smaller dose? The idea behind the experiment is that if a high dose of hormones doesn't help us get a lot of mature eggs, then we might as well use a smaller dose of injections to get a bit more mature eggs. Some patients have a pretty good response to this smaller dose, which is a surprise. This is a low-risk, low-cost method that should be tried. We will go ahead with the plan even if these patients only have one follicle. Each egg is valuable, and we want them to have the best chance of getting pregnant. The goal of all of these plans is to get enough eggs so that we can make enough babies to give patients a good chance of getting pregnant. In 3 to 4 IVF rounds, we pool these embryos together and don't transfer any of them. Our goal is to store at least 3 to 4 high-quality frozen blastocysts before we start moving them. Your ovarian reserve goes down as you age, but your frozen embryos will always be as good as new, no matter when we use them. It is true that this treatment plan can take a long time and cost a lot of money. This is why these difficult patients need to have realistic hopes for what IVF can provide them. This way, they can be sure that they did everything they could to have a baby. If everything fails, then plan B is to use donor eggs. This has a much higher success rate, and it's easier to accept this option when you know that you have tried everything possible to get pregnant with your own eggs, but everything you tried hasn't worked. Send us your medical details by filling in the free second opinion form and we'll be happy to help you to have a baby.